Welcome to the deep dive. Today we're getting into a really challenging area of canine health, a specific and pretty aggressive type of oral tumor that tends to show up in young dogs. Our plan is to really understand its key features, why it's so tough to diagnose and treat, and, well, what the outlook typically is.
Yeah.
We're basing this on a medical resource that focuses specifically on undifferentiated oral cavity tumors in young dogs.
Yeah, and what strikes you straight away is how uncommon this is. It's definitely not something vets see every day. And it's especially worrying because it hits young dogs, usually under 2 years old. We tend to see it in a specific spot, too, the back of the upper jaw, the caudal maxilla,
Okay.
and sometimes near the eye socket, the orbit.
Okay, that word undifferentiated is right there in the name. Let's maybe unpack that first. When we say tumors undifferentiated, what are we actually talking about?
Right. Well, think of it like this. Pathologists look at cells under a microscope, yeah? They're usually trying to match them back to the normal tissue they came from. Was it bone, muscle, lining tissue? With undifferentiated tumors, those clues, they're just missing. The
Yeah.
cells don't really declare what they are. And this isn't just academic. I mean, it likely means these cells aren't playing by the normal rules. They can grow faster, more erratically. It also makes treatment harder because a lot of therapies target features of specific, differentiated cell types.
Ah, okay, so they're kind of like blank slates, cell-wise. Makes sense, that's a problem. So if a young dog starts developing this, what might an owner notice first? What are the warning signs?
Well, these things grow fast, really aggressively. So an owner might see a lot more drooling than usual,
Yeah.
or really persistent bad breath, halitosis, we call it. It just doesn't clear up. As it gets bigger, swallowing might become difficult, or maybe the dog goes off their food, seems reluctant to eat. That's dysphagia or dysrexia. Sometimes owners even see some bloody discharge from the mouth, and weight loss can happen too.
Okay, and then when the dog gets to the vet, what might the vet pick up on during an exam?
Well, they'd almost certainly feel or see a mass in the mouth. But, the tricky part is these tumors often don't have a nice capsule around them. They can look smooth or maybe just a bit bumpy. So sometimes, initially, it might get mistaken for something less sinister, like maybe gum disease or just a benign lump. But they can also get ulcerated, look quite sore.
Hmm.
Other signs, maybe loose teeth nearby. Sometimes the face looks swollen or misshapen. Or if it's near the eye, you might see the eye bulging out. That's exophthalmia.
Okay.
And feeling the lymph nodes under the jaw and the neck. They're often swollen. Cervical lymphadenopathy. And the dog might show signs of pain when the vet examines the mouth or even just tries to open it.
Right. So lots of potential signs pointing to something serious going on in the mouth. But you mentioned standard blood tests might not show anything unusual. So where do you go from there diagnostically?
Yeah, exactly. Routine bloods, urine tests, often surprisingly normal. Because the main problem is still localized, you see. It hasn't necessarily caused system-wide changes yet. So the next step is usually cytology. Taking a small sample, maybe with a needle, from the mass itself and any swollen lymph nodes. Looking at those cells gives you a preliminary idea, often a strong suspicion of cancer.
But not the final answer.
No, for the definitive diagnosis, you really need histopathology. That means taking an actual tissue biopsy, a small piece of the tumor. That gets processed, sliced very thin, and examined properly under the microscope, and that's where you'd see this.
Well, this undifferentiated malignancy, the cells just lack those defining features of, say, connective tissue or lining tissue. No clear pattern, no obvious origin, just undifferentiated.
Okay, and the resource mentions something called immunocytochemistry. Why is that needed? Yes, that's really important here. Because they look so nonspecific visually, immunocytochemistry helps. It uses special stains, markers that stick to specific proteins inside the cells. By seeing which markers light up, so to speak, we can try and rule out other nasty tumors that can pop up in young dogs and sometimes look similar. The resource specifically mentions rhabdomyosarcoma, that's a muscle cancer, as one you'd want to differentiate using these markers.
Got it. So it helps narrow things down even when the basic appearance is vague. We've established it's fast-growing, hard to classify. What about how it behaves locally? Does imaging help clarify that?
Oh, absolutely. Imaging is critical. Simple skull x-rays can often show if the tumor is invading the bone underneath. And that's pretty common with these tumors, unfortunately. They tend to eat into the bone. Chest x-rays are also standard, really important to check for spread to the lungs, metastasis. These tumors are known for having a high potential to spread. But for really understanding the local picture, exactly how far it extends, which tissues are involved, you often need more advanced imaging. things like CT scans or maybe MRI. They give you that detailed 3D view, which is vital if you're even considering something like surgery.
It sounds like, yeah, by the time you really grasp the full extent, it could already be quite widespread locally or even further afield. So what does that mean for treatment options?
Well, first off, practical things like diet. Soft food is usually recommended just to make eating more comfortable, less likely to injure the tumor, especially if it's ulcerated, or after any surgery attempt.
Right.
As for surgery itself, like really aggressive surgical removal, radical excision, the resource suggests it's often, well, ineffective. Usually because the tumor is already too widespread locally or it's already metastasized, even if we can't see those tiny spreads yet.
Wow.
If surgery is attempted, you need really wide margins, like at
Yeah.
least 2 centimeters of what looks like healthy tissue all around the tumor. And ideally, you'd use those CT or MRI scans to guide exactly where to cut.
That sounds incredibly difficult in the mouth area.
Yeah.
What about radiation or chemo? Are they options?
Yeah, it's tough. For radiation therapy, the data just isn't really there for these specific tumors. The resource indicates they often don't respond well. It might be considered, but more for palliative reasons, trying to manage pain, improve quality of life for a time, often using a less intense schedule, hypofractionated protocol, they call it.
And chemo?
Similar story, unfortunately. Limited evidence on efficacy, and many cases just show poor responsiveness. Plus, you always have to weigh the potential toxicity, the side effects of chemotherapy. The resource definitely advises consulting a veterinary oncologist. And again, because the cells are undifferentiated, it's harder to find drugs that specifically target them, you know.
So the main cancer treatments have limited success. What's left? How do you manage these poor dogs?
Pain management becomes absolutely paramount, really critical. And usually it needs a multi-pronged approach, what we call multimodal analgesia. So that might involve NSAIDs, nonsteroidal anti-inflammatories, plus stronger opioid painkillers, maybe other types of pain meds called adjuvant analgesics. And potentially, if there's a lot of bone destruction, drugs called bisphosphonates can sometimes help with that specific type of pain.
Given all of that, the aggressive nature, the diagnostic hurdles, the treatment limitations, what's the typical prognosis?
It's generally very poor. Yeah, unfortunately. The resource states that most dogs probably have microscopic spread, metastases already there when they're diagnosed, even if we can't see it yet on scans. And because the tumor grows so quickly, so relentlessly, and quality of life declines rapidly, sadly, most dogs are euthanized within about 30 days of diagnosis.
Wow. That's incredibly fast and just heartbreaking.
It is. It really highlights how aggressive this disease is and the toll it takes.
Yeah, just devastating for everyone involved. And do we have any idea why this happens? Any known causes or risk factors for this specific tumor?
No, that's another challenging aspect. The resource is quite clear. No specific causes or risk factors have been identified. It just sort of appears, which makes it even harder to prevent or predict, obviously.
Okay, so if we try and pull this all together, what we've explored today is this thankfully rare but highly aggressive oral cancer in young dogs. It throws up major challenges right from the start. Diagnosis is tough because it grows fast and can look like other things. And that central issue, the fact that it's undifferentiated, means we don't fully understand its origin. And crucially, our usual cancer weapons like chemo and radiation often don't work well, which sadly usually leads to a very poor outcome due to that early spread.
That sums it up really well. Yeah. That undifferentiated aspect is kind of the central mystery and the main obstacle. Not knowing the cell type it came from really hampers our ability to figure out its specific weaknesses and develop targeted treatments.
It certainly does underscore how much more there is to learn about cancer, doesn't it? Even in our pets. But, while this specific tumor type is rare and the prognosis is so grim, it's maybe worth remembering that all the research, everything we learn studying these aggressive cancers in animals, it feeds into a bigger pool of knowledge. And sometimes that knowledge leads to unexpected breakthroughs, potentially helping both animals and maybe even people down the line, perhaps focusing on what makes this undifferentiated tumor unique in young dogs. Maybe that could unlock some clues with wider applications. You never know where the next insight will come from, right?
Absolutely. That interconnectedness in research across species is definitely real. Insights often come from unexpected places.